All right, excellent, guys. Excellent. Good morning, Austria, Praveen. What is his name? Ritik, Hirutik, right? Pratisha, Prakushti, everyone. Welcome to the session. Okay, today we'll begin with anti-cancer drugs, the cancer of your life. All right. Okay, MCQ number one. Let's shoot. Superficial bladder cancer can be treated by direct instillation of the anti-neoplastic antibiotic agent mitomycin, right? This process is termed as, right? So this was an old MCQ where they had asked you, whenever I give a drug through an orifice into the body, what is it called as? Instillation. This is a PYQ. This is a PYQ, right? Process is called as instillation whenever through an orifice. So I'll catheterize the patient and inject the drug into the bladder for local effect. Toxicity is less, efficacy is more. Okay, so what is the answer? Come on, guys, others. Hirutik has given the right answer. Aryan, Pratishtha. All right, guys, so B is the right answer. This is called as intravesicular administration. Okay, can you guys give me any other drug also given by intravesicular? A very commonly used drug. All of you know that drug. You know that drug. Believe me, you know that drug. Which drug is that? All of you know that drug. Come on. Which other drug is given? Okay, the drug is related to tuberculosis, TB. That is your best possible clue I can give you guys, right? Related to TB, tuberculosis. Which drug is that? Come on, anyone? No one? Okay, so in bladder cancer, very good. Pawan Ka Jhoka has given the right answer. BCG, intravesicular administration. I can also give BCG for bladder cancer. All right. So mitomycin C, BCG can also be given in bladder cancer. All right. So there are two learning points here. Point number one, whenever I give a drug through an opening or into the bladder or any orifice, it is called as instillation. Two drugs are used by intravesicular route, mitomycin and BCG. All right. Moving on. Next question. Nurse is providing teachings to a client receiving cyclophosphamide or cytoxan, the brand name. The nurse tells the client to which of the following? So as a nursing officer, what would you advise the patient? Eat foods rich in purine, increase fluid intake to 2 to 3 liters per day, eat foods rich in potassium, take the medication with food. Okay, guys, what would you advise? What would you advise the patient? Or refer the patient as far as possible. Do not come back to our hospital, right? What would you do? Come on, guys. Okay. If you don't know the answer, let me first of all tell you what is the side effect of cyclophosphamide. Cyclophosphamide can cause a side effect called as hemorrhagic cystitis. So the drug is toxic to the bladder, and it would cause hemorrhagic cystitis. Now the answers are flowing, right? What is the answer now? At least now, कम से कम अब तो पता है यार. At least now you can answer. Hemorrhagic cystitis. What would I ask the patient to do? Come on. B, very good. Increase fluid intake because I want the toxin to get out of my bladder as soon as possible. All right. Now, for this hemorrhagic cystitis, to prevent this, one thing is, this is what I can do. The doctor would prescribe a drug called as Mesna. So there are two MCQ points with respect to cyclophosphamide causing hemorrhagic cystitis, guys. Excellent. All right. Methotrexate interferes with folate metabolism by inhibiting. Now, this is the easiest possible MCQ. Easiest one. The option itself is calling you. Come, mark me. I am the answer, right? So what is the answer here? Xanthine oxidase, DNA gyrase, cyclooxygenase, DHFR. What is the answer? Come on, guys. You cannot miss this one. This one, there is. Come on, come on. What is the answer? Oh, come on, guys. What is the full form of DHFR? Anyone? What is the full form of DHFR? What is the full form of DHFR? Tell me. What is the full form of DHFR? Anybody? What is the full form of DHFR? Anybody? DHFR. Okay, dihydrofolate close. DHFR is dihydrofolic acid reductase, right? Dihydrofolic acid reductase. What I'm asking, folate metabolism, which has folate in it, folic acid, DHFR. Sometimes the MCQs they themselves want you to answer. So methotrexate is an inhibitor of DHFR. Methotrexate, right? Xanthine oxidase, it is blocked by which drug? Xanthine oxidase. Allopurinol, it is used in chronic gout, right? DNA gyrase, it is blocked by which class? Fluoroquinolones, antibiotics. Cyclooxygenase, it is blocked by which class of drug? NSAIDs. All right. It's a simple MCQ, guys. Simple, very simple. All right. High dose methotrexate therapy may be followed by which rescue treatment? So you remember in the class I talked about drugs and antidotes. I told you methotrexate, pemetrexate, I need to give something. I need to give something with methotrexate and pemetrexate. Which one is this? It's a very simple MCQ. Antidotes, remember I told you, as nursing officers, antidotes should be on your tips. It is expected out of you guys. So what is the answer? Excellent, guys. Answer is A, leucovorin. Answer is A, leucovorin. All right. Okay. A patient receiving doxorubicin requires particular monitoring of. Okay, one more thing. Leucovorin is also known as folinic acid. Now, if it is not there, an alternative to this is folic acid. So whenever they would ask you about antidote of methotrexate to prevent toxicity, your better answer would be leucovorin, also known as folinic acid, that is synthetic. It is costly. If a patient is poor, cannot afford folinic acid, go for the alternative drug, that is folic acid. All right. Okay, next. A patient receiving doxorubicin requires particular monitoring of. Patient receiving doxorubicin requires particular monitoring of. Come on. Okay, all of you have given the right answer already. Cardiac function. So remember, doxorubicin and another drug, daunorubicin, both are cardiotoxic. Right, cardiotoxic. How they can ask this MCQ? What can be seen? For example, they can cause cardiomyopathy. Cardiomyopathy. They can cause cardiomyopathy. So they can ask like this. A patient was given a drug. It develops cardiomyopathy. Which drug was given? Doxorubicin. Right. Okay. Next. Which agent can reduce anthracycline-associated cardiotoxicity in selected patients? See, anthracycline is the group. Under anthracycline, I have drugs like doxorubicin and daunorubicin. Under anthracyclines, I have drugs like doxorubicin and daunorubicin. Under anthracyclines, I have drugs like doxo and dauno. So what could be my answer? Dexrazoxane, mesna, leucovorin, naloxone. What is the answer, guys? The answer is dexrazoxane. What is dexrazoxane? It is an iron chelator. It is an iron chelator. Okay. Now let me summarize. Do you know what is heart called as in Hindi? Hindi में heart को क्या बोलते हैं? Little bit of Hindi I'll teach you today. What is heart called as? In Bollywood, half of the songs are not possible without this word. Come on, guys. Come on, my Kannadigas. Dil, very good. Dil, right? So, dil. So, dil toxicity. Dil toxicity is caused by doxorubicin, daunorubicin. Dil toxicity treatment is dexrazoxane. So remember D, 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 3Ds. So remember this as 3D, 3D, right? 2D, doxorubicin cardiotoxicity. Treatment, D for dexrazoxane, which is iron chelator. Excellent. So my Kannadigas know the little bit of Hindi as well. All right. See, deferoxamine. Okay, let me tell you. Deferoxamine is another iron chelator. It is another iron chelator which is used in thalassemia. All of you know what happens in thalassemia. I give blood transfusion. So iron load increases on the patient. For that, I use deferoxamine. Both are iron chelators, but remember, the uses are different. Dexrazoxane is used in cancer to prevent cardiotoxicity by doxo or daunorubicin. All right. Whereas deferoxamine, it is an iron chelator used in thalassemia. I guess. So Yamuna, I hope this is clear, my dear. Right? Okay, a patient receiving cisplatin requires monitoring of nephrotoxicity and ototoxicity. Okay, you didn't allow me to read all the options also. So you guys are so smart. Excellent, guys. I'm proud of all of you. Nephrotoxicity and ototoxicity, right? Plus, remember, cisplatin produces maximum nausea, vomiting. And for this, my drug of choice is ondansetron. So there is one more MCQ point here. Cisplatin produces nephrotoxicity, ototoxicity, maximum nausea, vomiting. For nausea, vomiting, the drug of choice is ondansetron, right? Okay. Trastuzumab is targeted against what? HER2, CD20, TNF alpha, EGFR only. I have told you this. I've taught you breast cancer. If you guys remember in detail, I talked about breast cancer. All right. No, yes, what is the answer? Trastuzumab. Trastuzumab. What is the use of trastuzumab, guys? Remember, I talked about this drug. It is used in breast cancer. I talked about ER positive and the second one, HER2 positive. Is Roshni has given right answer. Varsha has also given right answer. Answer is HER2. Right. So HER2 positive breast cancer, my drug of choice is trastuzumab. So trastuzumab is the drug of choice for HER2 positive breast cancer. Trastuzumab is the drug of choice for HER2 positive breast cancer. All right. A patient is supposed to be started on cisplatin. The nurse should give which drug before it? Cisplatin. Okay. Leucovorin, mesna, pyridoxine, mannitol. Again, cisplatin is a very important drug. In the nursing exams in anti-cancer, cisplatin is commonly asked. Come on, guys. What is the answer? Budi, Budiga Pogu, my dear friend. It is not leucovorin. Leucovorin is for methotrexate, right? See, pyridoxine. Sorry, it's the wrong answer. The answer is D, mannitol. Okay. Cisplatin produces nephrotoxicity. Nephrotoxicity. Okay. How do I prevent it? How do I prevent it? Normal one. I give 1 to 2 normal saline. So normal saline will produce diuresis. And because of the diuresis, cisplatin would be driven out of your kidney as soon as possible. Right. So one, I give normal saline. Second, to make the cisplatin move out of kidney faster, I give an osmotic diuretic that is mannitol. I give an osmotic diuretic that is mannitol. All right. So these are two things I do, two MCQs possible here. Two MCQs possible here. And remember, normal saline is also given with amphotericin B. I taught you yesterday. So two drugs with which normal saline is given to prevent nephrotoxicity. One is cisplatin, one is amphotericin B. All right. Amphotericin B, one is cisplatin. So answer is D, mannitol, guys. D, mannitol. All right. Mesna, if you remember, see, leucovorin, I told you, methotrexate. Mesna is given with cyclophosphamide, again I discussed. Pyridoxine is given with 5-fluorouracil to prevent hand and foot syndrome. If you remember, I talked about that in the class. All right. Okay, cyclosporin is used in cancer, anemia, hyperkalemia, GVHD. Where do I use cyclosporin? Come on, guys. Where do I use cyclosporin? Cancer, anemia, hyperkalemia, GVHD. What do you guys think? Where do I use cyclosporin? Come on. Where do I use? Cancer, anemia, hyperkalemia, GVHD. It's not ACE. I'm discussing the cancer topic. It does not mean it belongs to cancer, right? It's used in GVHD. So what is cyclosporin? See, cyclosporin is an immunosuppressant. It is an immunosuppressant, and it is used primarily in two disorders. One is GVHD, graft versus host disease. Second one is graft rejection. GVHD and graft rejection. So it is an immunosuppressant that is used in GVHD and graft rejection. All right. So all of you know, GVHD graft rejection, it is where your immune system targets the organs. So I need to calm down. I need to suppress the immune system. So cyclosporin is an immunosuppressant. Now, do not confuse cyclosporin with cycloserine. Cycloserine is a TB drug. So I'm telling you here so that you don't get confused. Cycloserine is not equal to cyclosporin, right? I hope I'm clear. All right. Okay, a patient on cyclosporin should be monitored for hypokalemia, hypoglycemia, hypotension, hyperlipidemia. Now, if you do not know the answer, I have taught you this. I've taught you this in the class. If you don't know the answer, then what is your gut feeling? What is your gut feeling? Skip. Uh, Hirutik, don't skip. Don't skip in this class because I'm not going to give marks or ranks. So try to attempt at least something. Come on, Hirutik. Come on. Give me at least one answer. Whatever you feel like, whatever your gut says, whatever your gut says or your liver says, right? What do you think is the answer? Okay. Now see, here my answer is hyperlipidemia. So it should be monitored. So it is not hypokalemia. Everything here is hyper. Remember, everything is hyper with cyclosporin. Everything is hyper. You won't find anything hypo. You won't find anything hypo. So it causes hyperkalemia, hyperglycemia, hypertension, hyperlipidemia. Everything is hyper. Plus, remember, one side effect of cyclosporin, which is organ toxicity. It is hepatotoxic as well. So I need to monitor LFT. LFT. It is neurotoxic as well. Plus it is nephrotoxic as well. So with respect to cyclosporin, remember every organ can be targeted. Every organ, right? Every organ. Hepatotoxic, nephrotoxic, neurotoxic. So you have three major organs: heart, liver, and brain. So remember like that: heart, liver, brain. Everything is gone. Plus, uh, it can cause hirsutism and hyperplasia of gums. It can cause hirsutism and hyperplasia of gums. Can you tell me which other drug causes hirsutism and hyperplasia of gums? I have another drug that also causes this particular side effect. That is hirsutism and hyperplasia of gums. Come on, which other drug? Very good. Pravilika, Buddigo, Pogu. All of you have given the right answer, guys. I hope I'm pronouncing right. If I'm not, I'm sorry. Letrozole. No, it is hirsutism and hyperplasia of gums is caused by phenytoin. Phenytoin. All right. Okay, guys. So that's with anti-cancer drug. Now coming to endocrinology. Endocrinology, phenytoin, guys. Very good. Sharano, Pragya, all of you given the right answer. Dexamethasone is used to treat. It's a steroid, all of you know, right? Steroid. So where do I use dexamethasone? It cannot be very good, guys. Anaphylaxis. Dexamethasone is used for treatment of anaphylaxis, not for infection, arrhythmia, hyperglycemia. In fact, infection and hyperglycemia are side effects of dexamethasone. It's a steroid. All right. A pregnant female Salma with thyrotoxicosis is planned for surgery. Before surgery can be done, her gland should be reduced in size and vascularity by administering iodide ion, propranolol, propylthiouracil, radioactive iodine. Surgery. I have to decrease the size and vascularity. I have to decrease the size and vascularity. Hmm. The moment you look at thyrotoxicosis, you jump into PTU because she is planned for surgery and she is pregnant. See, I'm not asking, see, read the MCQ carefully. If they ask you treatment of hyperthyroidism in pregnancy, treatment of hyperthyroidism, pregnancy, first trimester PTU, second, third trimester, methimazole, right? Now, is this MCQ asking treatment of hyperthyroidism? Look at this. Is it asking treatment of hyperthyroidism? No. Female is pregnant, but they're asking before surgery, what is to be given to decrease size and vascularity of the gland. They're not asking which drug would be used for treatment of hyperthyroidism. I'm going to use a drug before surgery to decrease the size. Very good, guys. Now the answer is A, iodide ion. So read the MCQ carefully. I've taught you this. Come on. In hyperthyroidism, I told you about iodide ion. It is used to decrease the size. If I decrease the size, thyroid, all of you know, is a very sensitive area. So if it is small, I can easily remove it. If the vascularity is lesser blood vessel, means when I'll cut through the thyroid, bleeding would be less, and my surgical area would be much more cleaner. All right. Manish, a patient of hypothyroidism, was prescribed thyroxine. Which of the following is most reliable guide for adjustment of thyroxine dose in him? Pulse rate, body weight, serum thyroxine level, serum TSH level. Aye. Okay. Thyroid. Thyroid, there can be hyper or there can be hypothyroidism, right? In hyperthyroidism, T3, T4 is high. T3, T4 is high and TSH is very low, right? Because all of you know, see, TSH is required to produce T3 and T4. It is required to produce T3 and T4. So if T3, T4 is high, I don't need TSH. TSH becomes very low, right? In hypothyroidism, however, why there is hypothyroidism? Because TSH is high. In hypothyroidism, TSH is high, and TSH is high. That is why the T3, T4 is normal. Try to digest this. Hypothyroidism, all of you know the common cause is Hashimoto, and your thyroid gland is not able to produce adequate T3 and T4. So the T3, T4 should be less, but it is normal. Why? What is maintaining normal T3, T4? It is my TSH is high. All right, which means what? I cannot look at T3, T4 because it is normal. So what should I go for? I hope you guys have understood the disease. If you don't understand the disease, I cannot make you understand treatment. So what is the answer now? What is the answer now? TSH. Very good, guys. Did you understand the disease? So any patient, if you're a nursing officer, tomorrow you go to work, any patient of hypothyroidism, you look for TSH, serum TSH. And based upon that, I adjust the dose of thyroxine. All right. A patient of osteoporosis was started on alendronate. The nurse should tell the patient to take drug on empty stomach. take drug with a full glass of water, don't lie down after taking drug, all of the above. What is the answer? Come on, guys. What is the answer? What is the answer? All of the above. Never underestimate the power of all of the above. Right? All of the above a lot of times. See, when I was preparing for my exam, there are a lot of MCQs with all of the above or none of the above, right? And it was a saying among us. If it is all of the above or none of the above, that means don't use your cortex. That is the answer. But I'm not telling you to do that. Read the MCQ carefully, then only go for answer. Okay, so alendronate is a bisphosphonate used in osteoporosis. It can cause esophagitis. It can cause esophagitis. All right, to prevent esophagitis, ask the patient to take drug on empty stomach because it has poor oral absorption. That is a different thing. But to prevent esophagitis, number one, I'll ask the patient to take drug with a full glass of water because I want the drug to move faster into my esophagus. Then don't lie down. Why don't lie down? Then there will be reflux. Right, 30 minutes, 30 minutes, you'll ask the patient not to lie down. Some patients would ask you, nursing officer, what should I do in this 30 minutes? You'll ask him, do anything you want, but standing. All right. Watch TV, go around. All right. Prepare for NORCET exam. Anything. Standing. All right. A patient was started on insulin for treatment of diabetes mellitus. The nurse educates the patient to inject insulin in abdomen near umbilicus, inject insulin at same time, same site every day, inject insulin only at night, inject insulin and don't skip meal. It's an easy one, guys. You should be able to solve such MCQs in your dreams, right? In your dreams. Come on, bring it on, right? So D, inject insulin and don't skip meal. The reason being, otherwise the patient can have hypoglycemia, and hypoglycemia can be fatal at times. People can die. Remember, it is more dangerous. Why does metformin generally not cause hypoglycemia when used alone? So metformin, if it is used alone, it would never cause hypoglycemia. Know that. Number A, because it blocks insulin receptors, it does not directly stimulate insulin secretion. It increases glucagon markedly. It prevents glucose entry into cells. Okay, tell me, what is the possible answer here? Why does metformin generally not cause hypoglycemia when used alone? Pre-meal RBS, I didn't get your point. Pre-meal RBS should be checked. Yeah, RBS should be checked. Based upon that, you have to decide the dose of insulin. But nevertheless, the patient has to eat food, right? Even if glucose is high, you don't want to go the person hungry, right? Okay, so okay, excellent, guys. It does not directly stimulate insulin secretion. So remember, any drug that stimulates insulin secretion will cause hypoglycemia. Hypoglycemia. Okay, and hypoglycemia, remember, is caused by a class of drug called as sulfonylureas. And remember, all the drugs, they end with ride or zide. So whenever they ask an MCQ, which of the following drug can cause hypoglycemia? You don't know the answer. Look for ride or zide, like glibenclamide, glyburide, glyclazide, glimepiride. So ride or zide drugs. Why A is not correct? Metformin does not, see, it blocks insulin receptor. It is a false option. It has nothing to do with insulin receptor, right? It has nothing to do with insulin receptor. Metformin acts upon your liver, all right? A patient taking metformin becomes severely ill with, in previous question, which previous question? It is alendronate. A is not correct because it is injected in abdomen not near umbilicus. You have to, if this is the umbilicus, you have to avoid the peri-umbilical area because there the risk of lipodystrophy is higher. Patient on metformin becomes severely ill with renal failure and tissue hypoxia, which rare complication becomes a concern. Okay, metformin. The patient is already hypoxic. What is the concern? Ototoxicity, agranulocytosis, pulmonary fibrosis, lactic acidosis. Excellent, guys. Answer is D, lactic acidosis. Remember, whenever there is hypoxia, your body cannot use or perform aerobic glycolysis. It goes into anaerobic glycolysis, and that is where the patient develops something called as lactic acidosis. All right. A patient taking glimepiride skips lunch and develops sweating, tremor, and confusion. The most likely cause is hypoglycemia, hypercalcemia, ketoacidosis, hypernatremia. Very good, hypoglycemia. Now look, I told you earlier, if you do not know which drug will cause hypoglycemia, always remember ride or Zide drugs. This is a PYQ of your NORCET exam. So you have to be smart, right? Ride or Zide drugs, they cause hypoglycemia. A patient with heart failure is being evaluated for pioglitazone. Why should this drug be used cautiously or avoided? It can cause fluid retention. It causes severe bronchoconstriction. It produces marked diuresis. It always produces hypoglycemia. Pioglitazone is also an anti-diabetic drug. All right. So what is the answer, guys? What is the answer? Punita, hypoglycemia. No, it cannot be hypoglycemia. See, hypoglycemia, I already told you, hypoglycemia is caused by drugs which end with ride and Zide. Keep that in mind. Pioglitazone, does it have any ride or Zide? Nothing, right? So A, see, it can cause fluid retention. See, sometimes I told you, if you don't know the answer, still you can answer. What is the disease? Heart failure. How can I worsen heart failure? By bronchoconstriction. Diuresis will improve it. Fluid retention. So at times, even if you don't know the answer, try to use logic. Try to use logic, you'll find the answer. Even if I don't know the answer, I know for this fact, right? If there would be more fluid in my body, my heart failure would worsen. All right. So be smart, guys. A patient started on SGLT2 inhibitor like canagliflozin, dapagliflozin should be educated about increased risk of gingival hyperplasia, genital mycotic infections, optic neuritis, hyperprolactinemia. SGLT2 inhibitors, what do they cause? Very good. Genital mycotic infection. So the females will complain of vaginal pruritus and curdy white discharge because of vaginal candidiasis. Males can complain of penile ulcer or penile, that is called as what we call balanitis. Penile ulcer or balanitis can be seen. All right. Plus, SGLT2 inhibitors can also decrease BP. So as a nursing officer, they can ask you in the exam, what should I monitor in the patient? SGLT2 inhibitors, they decrease blood pressure because they lose sodium and water. So that is one thing. Plus, they cause dehydration. Second MCQ they can ask you as a nursing officer is what would you advise the patient on SGLT2 inhibitor? Maintain adequate hydration and ask the patient not to take only water because the body is losing both salt and water. So he has to take water with some salt in it. I hope this is clear. And dehydration becomes important in a country like India. And you know the reason. A patient needs insulin just before meals for rapid control of postprandial glucose. Which insulin is appropriate? A patient needs insulin just before meals for rapid control of postprandial glucose. Which insulin is appropriate? Which one is it? Very good, guys. So aspart, lispro, glulizin, regular, all of them, they can be used. All right. Which of the following is true about insulin icodec? Icodec, if you remember, this is a new insulin. And I think they will ask you in your exams. Long-acting insulin given OD, zero risk of hypoglycemia. Still need to use a short-acting insulin, zero risk of hypokalemia. Okay, guys, all of you fell into the trap. The trap was long-acting insulin is correct. Given OD is not correct. This is correct. It is the only insulin which is given once a week. And once a week, it is a basal insulin. Basal insulin once a week, not once a day. Zero risk of hypoglycemia. Wrong. It has any insulin will cause hypoglycemia, guys. Remember, C is correct. I still need to use a short-acting insulin. So once plus, I need to add a short-acting insulin before meal for postprandial hyperglycemia. Right. So it would cause hypoglycemia, hypokalemia, lipodystrophy. Everything would be C. All right. An unconscious hypoglycemic patient has no IV access. Which medication is appropriate? There is an unconscious hypoglycemic patient. There is an unconscious hypoglycemic patient has no IV access. Which medication is appropriate? Very good, guys. Glucagon. All of you are correct. I'm proud of all of you. Excellent, guys. All right. Not intranasal, intramuscular. Intramuscular. All right. Next, which insulin can be given IV in diabetic ketoacidosis? See, diabetic ketoacidosis is a medical emergency frequently asked in medicine. In medicine, sir must have taught you about DKA, ketone bodies, and the smell and the breath, etc. Right? And answer is regular insulin. So regular insulin is IV. Now I can also use in diabetic ketoacidosis. I can also use aspart, but I never use it. I never use it. The reason being it is much more costlier. Plus, it has no benefit with respect to regular insulin when I give it by IV route, right? So they will never ask aspart. Okay, now moving on to the next topic, guys. Autocoids. Which of the following groups of clients are most at risk of GI bleeding from the use of NSAIDs? Clients with dysmenorrhea, clients with headaches, clients with arthritis, clients with renal failure. Okay, come on. If you don't know the answer, apply your logic. Logic. If you don't know the answer, don't give up. Apply your logic. Right. Apply your logic and try to find the answer. Excellent, guys. Excellent. Prachi, Dinnan, all of you have the right answer. Clients with renal failure. See, NSAIDs, they are excreted by kidney. So, and they're nephrotoxic as well. So if there is renal failure, then there would be more NSAIDs in my body and would increase the risk of GI bleeding. Risk of GI bleeding. Okay. Can you tell me which NSAID has least risk of ulcer? Which one out of all the drugs we use, right? Which one has the least risk of ulcer? NSAIDs. Safest one is which one? Come on. The drug everybody knows that drug. Everybody has in their house. You have the drug. Probably now you might be having it in your pocket, right? It is PCM. Paracetamol lesser than aspirin. That is a reason why I told you earlier. Wherever there is pain and fever, I should go first for PCM, second for aspirin. Whenever there is inflammation, then first I should go for aspirin. This is simple logic, right? Because paracetamol is not active in inflammation. So PCM, pain, fever, I cannot use PCM, go for aspirin. Inflammation, directly go for aspirin. All right. Celecoxib, etc., they are less preferred, guys, because they have a high risk of causing myocardial infarction. Okay, which of the following NSAID is used to prevent thrombosis? Ibuprofen, ketorolac, aspirin, naproxen. Now, this is a gift from me to you. This is a gift MCQ, so that your confidence will rise. So all of you are confident after this MCQ, aspirin, right? It's a simple MCQ. Okay, no prizes for this one, guys. It was a gift from me. Okay. Next one, allopurinol is prescribed for the client with renal calculi to take home, right? The nurse should teach the client about which of the following side effects of this medication. Retinopathy, maculopapular rash, nasal congestion, dizziness. What is the answer? Come on. I have taught you allopurinol. I told you one side effect of allopurinol. It can cause Steven-Johnson syndrome. Do you remember? Very good, guys. Very good. Erutik has given the right answer, Steven-Johnson syndrome. So has Sonu and Achievers and Pooja also. All right. Excellent. Treatment of tumor lysis syndrome. Come on, guys. What would I use? Rasburicase, febuxostat, allopurinol, probenecid. Treatment of tumor lysis syndrome. What would I use? What would I use? Very good, guys. Rasburicase. Rasburicase, it is an uricase, and what it does, it breaks uric acid. It breaks uric acid, right? So it can be used for treatment. It can be used for treatment. Allopurinol can be used to prevent because it would block synthesis of uric acid. So if tumor lysis treatment they are asking, tumor lysis has already happened, then there is no point in blocking synthesis because uric acid is already high. I have to break the uric acid. So I'm going to use rasburicase. All right. Excellent, guys. Excellent. All of you have given the right answer. Aspirin is generally avoided in children with a certain viral illness because of risk of what? Ray syndrome, Redman syndrome, Gray baby syndrome, purple glove syndrome. Oh my God, so many syndromes. Okay, excellent. Ray syndrome. Let us learn about the other syndrome. Redman syndrome. Which drug? Come on, Redman syndrome. Answer. Redman syndrome. Vancomycin. Very good. Redman vancomycin. Okay, Gray baby syndrome. Gray baby syndrome. Gray baby syndrome. Gray baby syndrome. Chloramphenicol. Very good. Chloramphenicol. Purple glove syndrome. Purple glove syndrome. Very good. Phenytoin. Purple glove syndrome. Phenytoin. Purple glove syndrome. Phenytoin. All right, guys. Okay. Which antidote should be administered for significant paracetamol poisoning? Okay, I had no doubt you would answer this. Okay, paracetamol poisoning causes toxicity to which organ? Liver. It is hepatotoxic. Very good, right? What is the cause? Cause is not paracetamol, mind it. Cause is not paracetamol. The cause is a metabolite of paracetamol. Cause is a metabolite of PCM. What is the name of that metabolite, guys? The name of that metabolite is NAPQI. Very good. Varsha has given right answer. Excellent, Varsha. NAPQI. Right. NAPQI. Now, what N-acetylcysteine does? N-acetylcysteine, it blocks NAPQI. Right. So these are some points which you guys should know about, right? Now, if N-acetylcysteine is not effective, imagine N-acetylcysteine is not effective, then what should I do? Apart from praying to God, what else should I do? N-acetylcysteine is not effective. Dialysis. Okay. Remember, my friend, dialysis is the end treatment for aspirin. Aspirin toxicity, I first use bicarbonate. Remember, aspirin toxicity, first I use bicarbonate. If bicarbonate is not effective, then I go for dialysis. That is for activated charcoal See, time is gone. Charcoal is a very small person. It is a very small thing. Plasma person. No, I'll go for liver transplantation. You cannot do anything because if N-acetylcysteine is not effective, prolonged use of aspirin can risk of GI cancer. No, my dear friend. Aspirin rather decreases the risk of colon cancer. Aspirin does not cause because cyclooxygenase is an enzyme which is proliferative. It causes proliferation of cells. So if I inhibit COX by giving aspirin, it will decrease cancer. Which cancer? Colon cancer. All right. So liver transplantation. Remember, right? Looking at paracetamol, it does not seem right. It does not fit. The paracetamol, for paracetamol, I have to do liver transplantation, isn't it? But pharma is a funny subject. All right. Allopurinol lowers uric acid primarily by inhibiting. Anyways, I've given you the answer before this. Xanthine oxidase, right? Allopurinol, xanthine oxidase side effect. I've told you allopurinol. One more point. It is a drug of choice in chronic gout. What is the drug of choice in acute gout? Drug of choice in acute gout. What is the drug of choice in acute gout? Acute gout. Come on. Indomethacin. It is a drug of choice. Imipramine. Sharano. Imipramine is for nocturnal enuresis. Nocturnal enuresis. Right? Now, it's not for gout. A patient with generalized urticaria suddenly developed wheeze and hypotension. Which medication has priority? Wheeze and hypotension, urticaria. So all of you know urticaria is something which is allergic. Allergic means it is caused by histamine. And all of you know what happens in urticaria. The patient develops wheals, right? Wheals. Allergic, histamine, hypotension is kind of anaphylaxis. Is developing anaphylaxis, right? Anaphylaxis. So I'm going to give what? IM epinephrine. So it might go into anaphylactic shock. Is because of hypotension. So there is bronchoconstriction causing wheeze, plus there is hypotension. Excellent, guys. Now coming to GIT. Drug of choice for GERD. What is the drug of choice for gastroesophageal reflux disease? GERD. What is the drug of choice for GERD? B. Very good, guys. PPIs. Proton pump inhibitors are the drug of choice for GERD. PPIs. Right. And GERD, they are given by oral route. Now, in case of an acute bleeding ulcer, I use IV PPI. So remember, IV PPI is the drug of choice for acute bleeding ulcer because PPI, what it does, it changes the gastric pH into alkaline or basic, and basic pH promotes coagulation. So bleeding will decrease. All right, PPIs. Okay, the image given below is used as, so look at the image, dicotyl sodium, osmotic agent, bulk forming agent, stool softener, stimulant, purgative. So what is the use of this? What is the use of this? Stool softener. Very good. Osmotic agent, the most important one is lactulose. Bulk forming, these are drugs like psyllium husk. Psyllium husk. Do you know what is psyllium husk? What do you call psyllium husk in Hindi? See, Kannada, I don't know. I don't know Kannada language. Yeah. So I don't know what is called in Canada. What is it called in Hindi? I can teach you that. Psyllium husk is called as what? Isabgol, Aryan, very good. Isabgol. Now, Isabgol is an amazing product, but earlier it was thought to be a product used only by elderly people. So I've seen my grandfather, grandmother using Isabgol because what happens is with aging, you lose the tone of your intestine. So aging causes constipation, right? Now, fiber intake should increase. And we Indians, we are not fiber eating people. I mean, salad. What is the salad we eat? We take one cucumber, cut it into slice, one slice to every person in the family member, right? When you should be eating with every meal, at least one cucumber, one tomato, every person should do that, right? Nowadays, psyllium husk has rebound back. Now, the things which we Indians look down upon are actually accepted by the West. So now in US, Europe, Australia, they're using psyllium husk, and there is a new thing called as psyllium husk coffee. So if you guys are coffee lovers and you want the coffee to cause lesser gastric irritation, what you can do is take a teaspoon of psyllium husk, dissolve in black coffee, and drink it. That gives a viscous consistency to coffee. Feels feels the taste is also good. Plus, it is a good one. I mean, you can try this. People are doing this. Stool softener is diicoside sodium. Stimulant purgative is a drug called as bisacodyl. Bisacodyl. So these are the examples I should know. All right. Antacid drug that typically causes diarrhea. Aluminum hydroxide, sodium bicarbonate, magnesium hydroxide, calcium bicarbonate. Which antacid can cause diarrhea? Come on. Which antacid can cause diarrhea? Aluminum hydroxide, sodium bicarbonate, magnesium hydroxide, and calcium bicarbonate. And calcium bicarbonate. Come on, guys. Which one? See, aluminum causes constipation, whereas magnesium causes diarrhea. That is the reason why we always combine both in antacid so that they can cancel each other. If you remember, I have taught you this. If you remember, I have taught you this. One second. Huh? Okay. So answer is what? At least now tell me the answer. Answer is C, magnesium hydroxide, guys. And that is the reason why. See, do you remember nowadays magnesium supplement is very popular for sleep. For sleep. For sleep, which magnesium is used? Sleep is very popular for sleep. So what magnesium does is it relaxes your nervous system and you'll have a peaceful sleep, right? That is magnesium bisglycinate because it crosses blood-brain barrier. Magnesium bisglycinate, right? So if you have insomnia or difficulty feeling or asleep or any relative, right? Today's world, what you can do, you can go. So there are multiple brands who are selling magnesium bisglycinate. Okay. Proton pump inhibitors are most effective when given with meals along with H2 blockers half hour before breakfast after prolonged fasting. Which one is it? Excellent, guys. Half an hour before breakfast. Now, this is the golden rule for giving PPIs. Why? Because PPIs, remember, PPIs, they decrease food-induced acid secretion. PPIs, they decrease food-induced acid secretion. And there is a reason why I have to take them before food. Remember, PPIs, they have no effect on basal acid secretion. So basal acid secretion means when you're not having food and acid is being secreted. PPIs, they don't have effect. All right. Okay. Sucralfate promotes ulcer healing primarily by sucralfate, forming a protective barrier at the ulcer surface, irreversibly binding proton pump, killing H. pylori alone, blocking dopamine. It's a simple MCQ again. I've told you the class itself, sucralfate is called as a gastroprotective agent. It protects the ulcer, lays down over the ulcer like a carpet. All right. A chemotherapy patient receives ondansetron for vomiting. Which receptor does it block? Chemotherapy patient receives ondansetron for vomiting. Excellent guess. Answer is A, 5-HT3. A, 5-HT3. A patient receiving metoclopramide develops torticollis and facial spasms. What is the likely adverse effect? Nephrotoxic syndrome, ototoxicity, hyperkalemia, acute dystonia. Excellent guys. You remember, I taught you this. Give metoclopramide and the patient becomes like this, right? So this is acute dystonia. All right. How would you treat it? How would you treat it, guys? Come on. How would I treat it? How would I treat it? Come on, Canadiga warriors. How would I treat it? Hey, come on. I taught you this. Okay, benztropine, but the drug of choice is benzhexol. Remember, this is one they will ask you. Domperidone. No, my dear friend, Varsha, domperidone is anti-emetic. I don't use it for treatment here. Benzhexol or promethazine. Though benztropine can also be used. So, but in your MCQs, benztropine will never be asked. It will be mostly benzhexol or promethazine. If benztropine is asked, there are two more drugs. One is benztropine, another one is biperidine. These are three anticholinergics which can be used. Promethazine is an alternative drug. All right. Why is lactulose used in hepatic encephalopathy? As a nursing officer, you will be giving lactulose to a lot of patients in the medicine department or the gastroenterology department, patients on hepatic encephalopathy. All right. Excellent. It reduces intestinal absorption of ammonia. So what lactulose does, it converts NH3 into NH4 plus. That is ammonia into polar ammonium ion. It converts ammonia into polar ammonium ion. All right. So A is the right answer. It reduces intestinal absorption of ammonia. Okay, someone asked me about rat poisoning. See, rat poisoning, if you look at rat poisoning, it depends upon what is present in the rat poison. Is it organophosphate or is it carbamates? If it is organophosphates, I'm going to use atropine plus pralidoxin. If it is carbamates, I'm going to use only atropine. I taught you this yesterday. In case of carbamate poisoning, I cannot use pralidoxin. So depending upon what are the constituents of the rat poisoning, I'm going to decide, because there are different types of rat poisoning. Okay, now guys, moving on to respiratory system. Dextromethorphan should not be given with which drug? SSRI, MAO inhibitors, atropine, paracetamol. Dextromethorphan, where should I not give it? Or which drug I should not give dextromethorphan? All of you know dextromethorphan, it is used for dry cough. Dry cough. So for dry cough, I use one dextromethorphan. Number two, I use codeine. So two drugs are commonly used in dry cough. Okay, so what should I not give? What should I not give with dextromethorphan? Okay, A is the answer. Okay, tell me, what is the reason? Why A is the answer? Why A is the answer? Why? Why should I not give? Why A is the answer? Excellent, guys. Serotonin syndrome. So SSRIs are not to be given. Aminophylline is prescribed for a client with acute bronchitis. A nurse administers the medication knowing that the primary site of action of this medication is stool. suppress the cough, prevent infection, promote expectoration, relax smooth muscles of the bronchial airway. All right. No, you guys, come on. Relax smooth muscles of the bronchial airway. Correct. This is the correct answer, guys. A client is prescribed with guaifenesin. The nurse determines that the client understands the proper administration of the medication. If the client states that he or she will, option A, drink extra fluids while taking this medication, limit oral fluid intake, take the medication with meals only, take an additional dose once fever and cough persists. So all of you know what is guaifenesin. I told you about productive cough. Guaifenesin is used, it is an expectorant. Guaifenesin is an expectorant. All right, so what is the answer, guys? See, if you remember, I told you about expectorant. How does it act? Guaifenesin, whenever it goes into the stomach, it would irritate my stomach. It would irritate my stomach, and that would irritate vagus, and now vagus would irritate. Vagus would irritate my lungs, and my bronchi will oscillate. Now, I want the drug to irritate my stomach, so I want it to be diluted with water so that it can act upon the mucous membrane of the stomach. And for that, option A, many of you guys have given the right answer. A, or some of you have given the right answer. A, drink extra fluids while taking this medication. So guys, did you understand the concept? Don't just mug up. Try to understand the concept. I want the drug to irritate the stomach. More water means the drug would be diluted and it would begin to irritate the stomach, right? Everywhere. Montelukast is prescribed to a client with asthma. During the medication therapy, which of the following laboratories should be monitored? CBC, ALT, AST, calcium and platelet count, sodium and potassium. What is the answer, guys? Come on. Come on, come on. What is the answer? Hirutik A, Punita B, Sonena D. So we have all kinds of answers coming in, right? So you don't want to disappoint any option, is it? Okay, guys, Montelukast. Montelukast. So all of you know what is Montelukast. It is a leukotriene blocker, anti-leukotriene, right? It is used in asthma, and leukotriene blocker Montelukast is a hepatotoxic drug. Remember this. It is a hepatotoxic drug. Montelukast is a hepatotoxic drug. That's the only toxicity we have with Montelukast. Hepatotoxicity, ALT, AST, that's it. It's very important. Remember, Montelukast. Okay, you guys need a break already. Prapti. Why do you need a break? Give me a reason. You want to go to the loo, or are you hungry? You did not have your breakfast. Give me a good reason. Give me a good reason, and I'll give you a break. Why? Why? We have just started. All right. Don't worry. I'll leave you soon. I want hungry. Today is my fast. If today is your fast, then what is the benefit of a break? As it is, you cannot eat anything. So at least eat drugs that I'm giving you, right? Okay. Now seriously, do you guys need a break for 5-10 minutes? If you need a break, I can do that. That is not a problem. But I mean, it beats my logic that I mean you are on fast, and because see, I'll not take a lot of time because the exam is already knocking on your door. So I want to wind up the session as fast as possible so that you can go back and read yourself. Because see, teachers will come and go and keep on teaching you, right? Teachers are not going to clear the exam. You are going to clear the exam. So you have to sit and study. All right. 10 minutes. Now let us see how many people agree. Do you need a 10 minutes break? Then I give you a 10 minutes break. Do you need a 10 minutes break? See, your friends don't love you. Okay. I don't want a break. I don't want a break. I mean, I'll take another 20-30 minutes and we'll wrap up the today's session because whatever was more important we have covered yesterday. Okay, cromolyn sodium inhaler is prescribed to a client with asthma. A nurse provides instructions regarding the side effects of this medication. The nurse tells the client that which undesirable effect is associated with this medication. Right? Cromolyn sodium. So cromolyn sodium, it is used in asthma. It is a mast cell. It is a mast cell stabilizer. It is a mast cell stabilizer. So constipation, wheezing, insomnia, hypotension. What is the answer? Tell me. B, wheezing. Very good, guys. So cromolyn sodium can cause wheezing. And remember, cromolyn sodium is a mast cell stabilizer. It is the least toxic drug in asthma. So whatever drugs we have in asthma, out of all the drugs, the least toxic one is this one, right? All are inhalational steroids except beclomethasone, sodium chromoglycate, triamcinolone, budesonide. This is a PYQ of your exam. And it's a very simple MCQ, which is not an inhalational steroid. Which is not an inhalational steroid. B, very good. B, sodium chromoglycate. It is again, we talked about this. It's also a mast cell stabilizer. It's also a mast cell stabilizer. Which instruction helps reduce oral candidiasis from inhaled corticosteroids? Rinse mouth after inhalation, lie flat after each dose, drink no water afterwards, take aspirin with every inhalation. Very good. Rinse mouth after inhalation. Second, use a spacer. Third, use soft steroids. And these soft steroids are two of them, beclomethasone and cyclisonide. So remember, 3 ways I can decrease oral candidiasis. Rinse the mouth, use a spacer, plus try to use a drug which is soft steroid like beclomethasone, cyclisonide, which are inactive drugs. They're activated in the lungs by esterase. So while they're passing through my oral cavity, they are not active. Okay. Why is serum level or toxicity awareness important with theophylline? Option A, it has a narrow therapeutic index. Option B, it cannot interact with other drugs. Option C, it causes no cardiac effects. Option D, it is never metabolized hepatically. Very good, guys. It has a narrow therapeutic index. All right, so here its range is 5 to 15 milligrams per liter. 5 to 15. This is the normal range. 5 to 15 milligrams per liter. All right. Omalizumab is directed against. Omalizumab is a MAB, monoclonal antibody. It is used as the last drug. It is used as the last drug in asthma. Omalizumab, it is used as the last drug in asthma, right? So excellent, guys. It is A, IgE. Immunoglobulin E, it is anti-IgE MAB. And see, I use, normally what do we use? I use inhalational corticosteroids. I use LABA. I use leukotriene blocker. I use oral steroids. When nothing is effective, everything is gone. Nothing is effective. Even oral steroids are not able to control. Then I go for omalizumab. All right. Okay, blood. Look at this MCQ. 75-year-old man is brought to the emergency department after being found on the floor of his room. His wife tells you that his medical history includes 2 prior strokes. So he has stroke, for which he now taking a small pill that works on platelets. Your attending tells you that there are newer agents now work by preventing platelet aggregation. He asks you if you know the names of any such agent. You are very excited because in fact, you had just had your pharma class from Dr. Ranjan. What answer do you give? What is answer? Okay, guys, what is answer? C, very good, guys. C is the answer. C, clopidogrel. Clopidogrel, It is an anti-aggregant. It blocks aggregation. It blocks aggregation. And remember, suppose patient had MI, and after MI, patient was not given any stent, right? Stent was not placed. I use only aspirin. Now stent was placed. Then now what do I use? I use aspirin plus clopidogrel. I use aspirin plus clopidogrel. Or I guess, are we clear with this? Okay. A patient receiving UFH requires routine monitoring primarily with APTT, INR, bleeding time only, serum potassium only. So previous question is, patient had stroke. He's on a small pill that works on platelets, right? Physician tells you that there are newer agents that now work. Now here, the patient was on aspirin. The patient was on aspirin, right? And the question is asking, do you know any such new agent, which is an anti-aggregant like aspirin? Your answer is clopidogrel for that. All right. Patient receiving UFH, what do I monitor? APTT. Okay. Let us talk about monitoring. Monitoring. I need or I do not need monitoring. I need monitoring number one for UFH, APTT. For warfarin, I monitor PT-INR. No need for DLF. DOAC, direct acting oral anticoagulants, LMWH, and fondaparinux. All right, this is important, guys. Remember this. All right, alteplase is for thrombolysis. Very good. Ritik, you are good. Correct. Patient is given darbepoetin injection. The nurse should monitor heart rate, BP, urine output, skin color. What? What would you monitor? What would you monitor for a patient on darbepoetin? What would you monitor for a patient on darbepoetin? Skin color. Punita is saying skin color. What color are you expecting on the skin? Blue, gray skin, brown skin. What are you expecting? Urine output. Red. Oh my God. Dinan, red color. So give darbepoetin more RBC, he becomes red in color, right? Good logic though, but it is not correct. Come on, more RBC does not mean he'll become red. Have you seen patients of polycythemia vera? They have more RBC. Now see, try to under what is darbepoetin? It is erythropoietin. More RBC. More RBC means blood becomes viscous. Blood becomes viscous. Now at least tell me the answer. Blood becomes viscous. I've given the logic. Erythropoietin would increase RBC, blood will become viscous. I told you, you need to apply the logic. Always think, don't answer blindly. Don't answer blindly. Blood becomes viscous, so it can cause hypertension, plus it can cause thrombosis. So as a nursing officer, you need to monitor BP. Thrombosis, I cannot monitor obviously here. All right, very good, guys. A patient on heparin develops serious bleeding. Which antidote should be available? Protamine sulfate. Very good, guys. Protamine sulfate. Protamine sulfate is the antidote for heparin. Very good, excellent. Aspirin prevents platelet aggregation mainly by irreversibly inhibiting platelet COX-1, P2Y12, thrombin factor 10A. Very good. Platelet COX-1. This one is blocked by aspirin. P2Y12 is blocked by clopidogrel. All right. Alteplase given to an eligible patient with acute ischemic stroke works by activating plasminogen, blocking platelets irreversibly, inhibiting vitamin K, blocking thrombin activity. What is the answer, guys? See, ASE means it is an enzyme which has activity on plasminogen. There is a reason why the name is PLASE. It's an IV drug. PLASE means an enzyme that has activity on plasminogen, right? So the answer is it activates plasminogen. So now LT-PLASE can also be used in MI. But remember, there are two types of MI, STEMI and STEMI. And remember, I use it in STEMI, but never for NSTEMI. Now, this is another point. Remember, NSTEMI, I never use thrombolysis. All right. Patient with excessive fibrinolytic bleeding. Fibrinolytic means, it also means thrombolytic. Same thing. Fibrinolysis is also called as thrombolysis. Is prescribed tranexamic acid. It is prescribed tranexamic acid. It is classified as antifibrinolytic, thrombolytic, antiplatelet, direct inhibitor. What is the answer? Antifibrinolytic. Okay, can you? So here, tranexamic acid is antifibrinolytic, and how does it act? Can you tell me the mechanism of action of tranexamic acid? You must have read about tranexamic acid in surgery, in gynae. You know, it's used for multiple types of bleeding as well. Mechanism of action. How does it act? Come on. See, plasminogen is converted into plasmin, and plasmin breaks fibrin. So mechanism of action is it blocks plasmin. It is a blocker of plasmin. It is a blocker of plasmin. All right. Okay, guys. So that's all for today. Today we did not have many topics. Major topics I had covered yesterday. There were minor, smaller topics remaining, and I have tried to cover almost 70 to 80% via MCQs, whatever is important for your exams. I will share the PPT. Did you guys get the PPT yesterday? Did you guys get the PPT yesterday? The PPT is uploaded. The PPT is uploaded on your app. Did you check the app? It is uploaded on the app. Did you check the app? No. So please check the app today. And I'll again share the PPT today. And the PPT, it will be uploaded on the app. Now remember, see, prediction drugs. See, if you'll ask me what are the prediction drugs, one prediction drug is lithium. One is lithium. Second prediction drug is digoxin. Third prediction drug is theophylline. Third is MAO inhibitor causing cheese reaction. All right. So, and apart from this, one prediction that would always work is antidotes. You'll have at least 1 to 2 questions from antidotes, right? And plus lithium, digoxin, theophylline, MAO inhibitor, you'll have some MCQs from these topics. So guys, revise, give your best, right? Focus more on the high-yield subjects like MSN, psychiatry, obs gynae. Focus more on those subjects. All right. Pharma, revise, do as much as you can do. If you're not able to do it completely, if you're not confident, then also it is okay. Don't worry about that. Remember, in any competitive exam, you cannot be 100% perfect. You have to achieve near perfection. All right. So don't let that imperfection get into your confidence, guys. All right. Okay. So I'm leaving you early today because we are done with whatever important I had to discuss today. So I'm leaving you early so that you can go back and revise your subject. So whatever I did, revise the MCQs. Please go back today and revise the notes today itself. Have your lunch. After that, revise. And God be with you all. You all are hardworking guys. I was in your class and I've seen you guys are very serious. And I really enjoyed your class. You know, I was missing you guys after the class. You were a great bunch of students. So I wish guys you'll go forward and get good ranks and move ahead with your life. And live life happily ever after that, guys. Uh, class at 3 p.m. No, there is no class at 3 p.m. No class at 3 p.m., guys. See, I had discussed majority yesterday. Today, smaller topics were remaining. So whatever was important, I discussed. Nice chair. Thank you very much, guys. Thank you very much. Thank you. Salute to all of you. Bye-bye, guys. Take care. Lots of love. Blessings to you. Take care. Bye-bye.